You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. According to my first guest, he said nobody should be wearing a loose-fitting denture, and he says that mini implants are affordable and they work to lock something in so you can eat and chew. With us, we have an expert on the topic, Dr. Jason Bodnar. Dr. Bodnar, welcome to the program.
Great to be here, Randy.
Now, for people that don't know your practice, I guess you do more than just mini implants. Who's the typical patient? What are the different services that you offer?
We have patients of all ages at our practice. We're a general dentistry practice. We do everything from preventive care, where people have their teeth cleaned, to deep cleanings, to crown and bridge, to root canals.
All right.
And we do everything. We've seen almost everything. But the one thing that frustrates us, Randy, is when people come in and their dentures are moving around, or they're hurting them, or they just can't eat what they want, or they don't want to smile, or they're having pain. And over the years, we've just really worked hard to try to resolve that, and we couldn't always do that. And now with mini implants, we feel like we're making a lot of progress with this, and we're getting great results. Before, where the patient had to live with this denture that was moving around, now what we can do is we can put in 4 mini implants, 6 mini implants, how many the patient needs, and we can have that denture stabilized. It snaps in, and they can go about with their normal function like they never could before.
So what can they eat?
Well, I have patients come in every day, and they complain that they can't eat. They'll go out to a restaurant, and they have to look at the menu, and they have to go through and pick out certain things, even though they want something else, just because they can't chew on a steak or corn or anything like that. So what we're trying to do is take them back as close to their original dentition as we can, and allow them to live normally.
Okay, good. Now, as far as dentures, are there a lot of people where you are that have like an upper lower denture, or people that are headed to dentures?
Randy, we have a lot of edentulous people in Western North Carolina, and enough to fill up Clemson's Death Valley Stadium.
Okay.
Enough to fill that stadium up and overfill it. Enough to fill up Neyland Stadium at Tennessee. Another group of people, in addition to the people that have no teeth or wearing dentures, are people that are heading that direction. They have loose teeth. They have partial dentures. And we also can help them, getting them a denture in there, and place mini implants to stabilize that denture and allow them to do things they couldn't do before.
So if people have bad gums, let's say they have bad gums, obviously that's why they're losing their teeth. Are they still candidates to get like a mini implant?
They're great candidates. We could take these patients and we can remove the teeth that are bothering them. There's a disease process there. A lot of these patients have loose teeth. They have bad breath. They have pain. They walk around and they're covering their mouth. They don't have any confidence. And what we try to do is remove that disease process that has a systemic effect. It makes you feel bad all over, affects your confidence, affects everything that you're doing. And what we can do is we can remove those teeth, give you a denture.
So the gums get healthier when you remove the teeth?
The gums do get healthier. There's bacteria in there causing these decay, causing this loose teeth, and we remove that. We remove the disease process. We make them feel not only better by giving them a denture, we make them feel better overall.
So you don't like dentures, and this might be, I don't want to put words in your mouth, but is this the future of dentistry? That means, whether it's 10 years or whatever, that every denture wearer will have their denture attached to something?
Well, the future's here, Randy. The future's here.
Okay.
We can do this now. I wish every denture wearer would wear mini implants or have mini implants placed and wear those holding their denture in. I think it would make a huge difference. The problem is, we just got to get the word out there.
So denture wearers don't go to the dentist then, pretty much?
They do not. They do not. I very rarely see a denture wearer unless they're having a problem with their denture. And when I tell them about this technology that exists, that we can place implants, sometimes in as little as a visit or two, they just look at me like I'm just talking to hear myself talk. But when I show them some models, when I show them what we can do, I show them photos. A lot of them move to that way, and we have a lot of happy patients.
The people need to know that this is not to be confused with traditional implants. Mini implants, I guess initially have been controversial, but they become more mainstream. So you like minis. They work?
I do like minis. I initially placed traditional implants, and I still place traditional implants where they're indicated. But there's a population out there that have had not enough bone, not enough you can't do the traditional implant. They don't want to deal with going to a specialist and having a bone graft, having things that you need to have a traditional implant. The nice thing about minis is they are less invasive. Instead of making a bigger hole for an implant, you're making a very small hole. You don't need to make an incision on the majority of the cases.
What do you do? Just pop them in?
You numb up the gum, just slightly numb up the gum, and you place them right through the gum into the bone. They integrate, and then you adapt your denture to them, and they work great. And the other thing is they're a lot more affordable. They're a fraction of the cost of the traditional implants. Again, I think traditional implants have their role, but the minis, we're trending that direction. We're doing more and more every day. We're seeing a lot of success. Back to your original question, why aren't the patients coming in? I think a lot of these patients have been wearing dentures. The last person they want to see is me. Over the years, what they've done is they've gone to the dentist and they've been nickel and dime to death. They started out with a cavity, it progressed to a root canal, then the tooth was extracted, and then that process was repeated till they were in a partial denture. Then teeth were added to their partial denture. I have patients that come in and that partial denture looks like a rainbow. It's so many different kind of patchwork on it. And then they finally lose all their teeth. And what happens is the last person they want to see is the dentist. This process has been going on for 20, 30 years.
It's over for them.
They think it's over. And what happens is, what we identified is the patient does not want to come back to the dentist. They don't realize that we can do something to keep that denture from moving around. The other reason, I think a lot of patients are scared to come to the dentist. I'm scared to go to the dentist. When I told my parents I was going to dental school, they laughed. They said, "You, the guy that used to, they used to have to tell me we were going to McDonald's or something, and I'd try to jump out of a moving car." So I can identify with patients having fear. Now I have all my teeth, but I'm not going through what these patients go through, but I can understand that fear, and I try to.
I mean, do you still hear it where they say, "No offense, doctor, but"?
Every day.
Really?
Yeah, everyone says, "No offense, but I hate being here." And I tell them, I say, "You're not in the minority. Don't flatter yourself." And once we tell them what we can do, they no longer.
And these mini implants, I mean, and I know pain is relative, et cetera, but it's for some people, it's like not a painful experience. Is that right?
Well, when people ask me, one of the first things they ask me, "Does this hurt?" And I say, to me, I haven't had an implant. And to me, it seems like something that would hurt. So I could see why you would ask that question. But one of the first cases I ever did with implants, I had an older fella and I replaced multiple implants. And I wanted to see him the next day to make sure everything was going okay. And he came in and he was covered in grass. He'd been weed eating. And he said that he had forgotten that he had the implants placed. He said his wife yelled and said, "You have to get to the dentist." He said he just couldn't believe it. I could tell many other stories like that. I had one patient that was so scared, the chair was shaking. I thought it was my handpiece that I placed the implants with. I kept checking it, and it ended up with him. He came back and he said, I don't know what I was worried about. He said that was a painless procedure, other than getting a little shot at the beginning to numb the gum. And and I have so many stories like that. A lot of times I give pain medicine. The patients don't even get the prescription filled. So I could see why the perception would be there that this would be a painful process. But I just, every day we place these, and it's just not the case.
How old can you be to do this? Like get a mini implant?
Statistically, Randy, there is no age. We've done this in patients in the 80s. I think our oldest patient we've done was early 90s. This particular patient came in and he just wanted to eat beef jerky when he went bear hunting with his friends. He said that he's been bear hunting and he just hasn't been able to do this for years, and he wanted to see if there was anything he can do. And after all this time...
Was he wearing a denture?
He was wearing a denture, and he didn't have a lot of bone there. And he had been to other dentists, and they told him that he just was not a candidate for traditional implants. We looked at the x-rays, we did our diagnosis, and we placed implants on the bottom, implants on the top, and we fit them to his existing dentures. And he came in after, I think it was after his hunting trip, and he said for the first time in decades, he was able to sit there and eat and enjoy
beef jerky.
He was able to enjoy beef jerky, Randy, with his friends.
Is that right?
And yeah, and that was what he wanted, and it worked out for him.
If everything goes well, how soon could they eat after you do the procedure?
I like them to eat right away. I think that they're able to eat right away, and I tell them that. I like to see, how is this working? And one of the things I put them through...
Like right away, like the next day?
What I tell them is, I said, your only instructions are to go home and eat a steak, or eat what you like to eat, and let me know how it goes. Yes, sir. When I tell patients that they can eat what they want, they look at me skeptical. You mean I can eat right away? And I said, yeah, that's what I want you to do. That's your instructions. And I had one patient call me and they said, are you sure I can eat? And I said, yes, I want you to eat. And they said, well, I haven't been able to eat corn on the cob for years and it's in season now. And you sure that I could do that? And I said, yes, that's what I want you to do. And let me know how it goes. They called the next day and she told me that this was the first time in years she was able to enjoy corn without cutting it off the cob. And it just changed the way she was eating.
So with a snap in, snap out, supported by like 8 or 10 mini implants or 12 or whatever, they could eat corn on the cob.
She could eat corn on the cob, she could eat steak, she could eat salad, she could eat whatever she wanted.
And when it's all done, are these people saying, I should have done this years ago?
One of the first cases I did, it was for a lady that came in and she just said, this lower denture will not hold. And I explained to her that we can put some implants in there, mini implants, and hold that. Again, she had gone to for years to dentists and they said there wasn't enough bone. I think she was offered she could do a bone graft. She didn't want to go through all that. The expense was too much. And for a fraction of the cost and in less time and less invasive procedure, I told her we could do this. She looked at me like I was skeptical. In a couple visits, we had those in. She lived in a retirement home, Randy, and she went to this retirement home and she told 8 of her friends and they all started showing up. And we ended up doing mini implants on every one of those patients. And I wondered, how, if we would have got to these patients sooner or we could have done these mini implants sooner, how much we could have improved their quality of life and they wouldn't have had to wait so long.
So what about the way they look? Can you make them look real? Because I feel like I could spot a denture.
Randy, they look real. They look as real as their natural teeth. Sometimes better. People came in and they had teeth that had been filled or they are crooked or loose. And a lot of times we'll make them look better than their real teeth.
So you're a dentist, so you probably think that the smile is pretty important. How important do you think it is?
I think it's very important. It's the first thing we see. People, when they go to a job interview, that's what you see. You see people walking down the street. They just look like they're in a bad mood. They're not smiling. They might not be in a bad mood. They don't have a great smile.
Do you spot these people? Like you could tell when people are hiding their smile?
I can. Yeah, I'll look at patients and I will identify that. If I can go back a little bit, when I was in dental school, we were a new dental school and we didn't have an oral surgery program. And people that thought about being an oral surgeon, we were given a experience that not a lot of students have. We were able to go in and place implants. And I got interested in oral surgery. And I thought that, that might be what I wanted to be instead of general dentistry. I applied for an externship at Mass General Hospital in Boston. And that's where the Harvard med students go. And it was really an honor to be accepted there. When I was there was a young lady that had just waited till she was done with graduation. She had a little bit of a deformity and she wanted to have orthodontic surgery. And I was allowed in on that surgery and I saw her before and it was just very obvious. It was very obvious, how things weren't coming together. Her bite wasn't there. She didn't smile. She just looked very unhappy. The next day after the surgery, I went in with the doctor to see her. And even with the swelling, I was just amazed at how different she looked, what a difference this doctor could make. And he was able to take this young lady from almost, I wish I had pictures because she went from someone that, just probably did not like her smile or her appearance at all to even with the swelling post-surgery, she looked beautiful. And I just wondered how much that would have changed her high school years, what she could have done, what the confidence could have gave her with her smile. And it made me realize
So there's lots of people that hate their smile. I mean, you're a dentist, so
that's an extreme.
You run into these people.
That's an extreme example. And I ride motorcycles, Randy.
Okay.
I ride motorcycles. I like to ride Harley Davidsons. And this is a little story about a patient. And I go on these rides for fundraisers and things. And there's some tough guys out there that ride motorcycles. Well, one guy came in and he had the black leather on and the letters on the back. You might know these guys. He was a notorious guy.
Okay.
And his teeth were loose and very bad shape. He had his wife there. And he came in, he said, what can you do for me? And I said, you need to have these teeth out. I said, this is, they're probably hurting you. They're loose. You have bad breath. You have these problems. We need to take them out and make you a denture. And he was apprehensive. He said, well, what else can we do? And I repeated the same story. That was your only option. You had to have these teeth out and have a denture. After I convinced him of that, he was concerned that he had known people with dentures that were very unhappy with him. They moved around. He was very concerned about that. And this guy was sort of an intimidating guy. I almost thought about referring him down to somebody else because I kind of knew his background a little bit. But I said, you know what? This is what we do. We get great results. Why should I treat him different than anyone else? So we proceeded with the case. So what we did for him, well, we took his teeth out, the diseased teeth. He did tell me, he goes, I can't believe this, but I feel better overall without these teeth in there. And we gave him a full arch of teeth on the lower and a full arch of teeth on the top. And when we handed him that mirror, this rough guy that initially I was kind of apprehensive to work on, he stood up and he was just standing there and he gave me a bear hug. And he was smiling from ear to ear and his eyes were tearing up. And I see this emotional response in a lot of patients. And kind of a little funny aside, if we have time. Yeah. About a week later, this guy's wife called and said she needed to see me. My assistant said she scheduled. She wouldn't say what for, but she didn't sound happy. And I said, all right, she liked the job and liked the work we did, loved his teeth. Maybe she wanted something done. But I did notice her teeth were pretty good, so I wasn't sure what she could be upset about. Well, when I came into the room, she stood up, and she was a bigger girl, not heavy, but just a big girl, very attractive big girl though. And she said, I need to talk to you. And I said, what? And she was unhappy. And she said, you need to get those teeth from him. And I said, what do you mean? She said, ever since he got those, he's down at the VFW hitting on everything that moves. And I hold you personally responsible. And I said, well, even though I'm sorry he's at the VFW hitting on everything that moves, I can't take his teeth. That's between you and him. And she was, I was in a lose-lose situation there.
So what'd you say to this?
I was trying to calm her down and she was getting angry. I mean, she was mad at me. So I was able to sort of work my way out of the room and get out of there. And as she was leaving, she said, you better watch yourself. Well, not weeks later, I was at a restaurant.
Story,
yeah, I was at a restaurant and I ran into them and a bunch of their other motorcycle group. And here she came over to my table, and I'm with my wife and little boy at the time. And I said, oh, here she comes. And my wife had known the story. And when she came over, her demeanor changed. She said, I want to apologize for what happened in the office. I just wasn't used to him being in such a good mood and being so outgoing. And before it was over, he was sitting at the table, this big, rough and tough guy holding my little boy. They were sitting there. They had friends coming over. They even invited me to ride motorcycles with them, and they haven't called me yet, and I think I'm happy about that.
So it's life-changing, for these people.
Life-changing. Here was a guy that, I was actually intimidated by, but after he changed his smile, it just changed him.
And if he didn't meet you, let's just suppose, okay, so there's people like this, their teeth have to come out, and they're stuck in these dentures, especially if you're riding a motorcycle. It's got to be, you got to worry that your teeth are going to come out. Or you can't open your mouth, I guess, while you're riding a motorcycle with a denture. Or you're afraid to.
People with dentures, they have a lot of things that they have to worry about.
Like what?
The denture moving around, hurting them. There's even a video I see, there's a lady skydiving and her dentures, it's not my patient, but I've seen it before, her dentures fly out. These are things that these patients don't have to worry about. Just this morning, I was at our hotel before I came over here, and it was quite a coincidence, but there was an area to get coffee, and I was standing there, and there was a lady standing there, and when she got her coffee, she reached over to get cream. Her dentures fell out right in front of me. Coming here to talk about mini implants, and her denture fell out. And she was embarrassed, and she said, oh, I'm so sorry. And fortunately, no one else saw, and I was the one, and I understood what she was going through. And we didn't speak about that, but this was the kind of things that can be avoided.
Now, I know some denture wearers, a couple of them at least. They never complain. Are you saying there's no such thing as a happy denture wearer?
Well, they're not going to complain to you, Randy, but they come in every day and complain to me. I've had patients that came in and they said, this denture doesn't fit. And I say, if we put mini implants in there, we can have it fit and stay put. They come in the next day and say, this denture's still loose, what can I do? I've told people, how many, they come back and then finally they do it and they say, their biggest complaint was they didn't do this before. And
okay. Why are dentures getting loose? What's going on?
Without teeth, the bone starts to melt away, and people have to come back every so often and have those dentures relined. People wearing dentures, they know that this is their reality. They have to come back and have this reline. When we place the implants, bone is not meant to have dentures sitting on it. It's meant to have teeth in it or these implants in it. And in addition to holding the denture, it prevents that process from the bone melting away. And what we find is, the patient's denture fits for a lot longer. They're a lot less frustrated. and their quality of life just improves.
Okay, good. Now you have models, and we have time to show those. So do you show these to patients? Okay, so a denture wearer comes in, or somebody that has to lose all their teeth, but they know they don't want a denture. This is what you show them?
This is exactly what I show them.
Okay.
We have this in the office. And probably the most common case we have is people with a lower denture. They come in and this is actually the upper case, but here's the lower, and their denture doesn't move around. A lot of times the denture on the upper will adhere to the top of the mouth, but it gags them and the implants work fine. But the main case they complain about is their lower denture.
Okay.
The tongue moves it around, there's just not as much adhesion. And what we do is on this particular model, I show them this. I say we can place 4, sometimes
Like just
6
4,
implants.
right?
Yeah, I place 4 implants right in the camera can zoom in. They can
All
see
right.
this. And inside the denture is the attachments,
Yeah.
and the denture will actually snap in. We place this on, and you can hear that snap.
We'll take a look here. Okay, so they get it snapped in. Okay, so right here, snap in, snap out. So this is the first level. Snap in, snap out, full arch of teeth. They could laugh, they could eat. No more adhesive or a little bit of adhesive?
No adhesive.
Okay.
Yeah, we're trying to avoid adhesive.
All right, all right.
We're trying to avoid adhesive. This is the lower, the most common. With denture, another thing that denture wearers do not like is on their upper denture. It covers the roof of their mouth. A lot of them complain that they can't taste. A lot of patients come in and complain that their denture gags them. And we needed that suction. We need the denture to go back. But now with the mini implants, we can place 4 implants or 6 implants, and we can do the same thing that we just showed on the lower arch, and we can replace.
Snap in, snap out.
Snaps in, snaps out. And again, the implants are the same thing we use on the bottom, and then it has the attachments, and we snap it in. And if you want to take it
Interesting,
out.
okay. So you just put more implants, like 8 mini implants. Snap in, snap out.
Every case is different. Some patients need 4, some patients need 6.
Okay.
We have to identify what the patient needs, and then we give them the proper.
So of all the denture wearers out there, are you of the feeling that if, like if there was a try-in, like test drive on the car, like if they could try this for the weekend, they would never go back to a denture just sitting on adhesive?
I think.
Do you believe that?
Well, I'll give you an example of this happening. I had a patient had a tough bite. We had to try a trial denture, and we wanted to. She was going to have zirconia teeth, really aesthetic, strong teeth. And what we wanted to do was make sure the bite was correct before, when the patient bit together, that everything was in equilibrium. So we made her one out of acrylic, just to be as an interim, just to make sure. And we put those implants in there, and then we were going to take the acrylic appliance, the acrylic denture, acrylic teeth, and we were going to replace it with her permanent teeth. Well, she came in and she was so happy for the first time. She said, "There's no way you're getting these away from me." She would not let us take those. So
Okay.
when patients, she was someone who was just trying it, she would not give it back. So I think if I'd love to see every denture wear.
Everybody should do it.
I'd love to see everybody do it. I think everybody would be happy.
Okay, so the next level up.
And what we can do is we can make. There's a lot of people that don't like to take things in and out, even if they're staying. And we can make a fixed bridge, or we can make something a little less cumbersome.
So teeth that don't come in and out, like a full arch of teeth that are fixed.
That's correct.
Okay.
And it's a very similar process. We use more implants. Sometimes it's 8, sometimes it's 10, sometimes it's 12, and we take the appliance, and you can see this. It's hard. We can.
What's that made out of?
This is made out of zirconia.
So it's not plastic. I mean, this is strong.
It's not plastic. This is a very tough porcelain material called zirconia. And we can place this in there, and the patient can't take it out. It's fixed. And they come in from time to time, or every so many months, and get their teeth cleaned, and we clean around the implants and make sure everything's fine. And we have some patients that really, really like that.
What could they eat with that?
Same thing
Anything
as
they
with
want.
the fixed denture. Anything they want. Again, we don't want them to go and do anything they wouldn't do with their normal dentition, but there's really no restrictions
But
on
you
what
want,
they can eat.
I mean, that's what everybody wants, right? Teeth that don't come in and out. That's just the next level up.
That's just the next level up. It's something that's a little less.
So mini implant, and we're out of time, but mini implants have become mainstream.
Randy, this is the next big thing. I go to a lot of CE courses on implants. And
CE meaning what?
Continuing education courses on implants. And this is the way we're trending. From mini implants that hold your existing denture in to mini implants that hold a fixed teeth in, where they don't come in and out. Oral surgeons are on board with this.
Really? So oral surgeons
Yeah, as a matter of fact,
are saying it's okay?
Yeah, as a matter of fact, I was a little skeptical about these mini implants holding a fixed appliance. And I went to a lot of continuing education courses. And what I found is this is the way it's trending. And we've done some cases, and we've given people teeth that are fixed, and we've had great success. Oral surgeons are on board with this. I was running, and I ran into a local oral surgeon, and I asked him, I thought he was going to be skeptical. I said, so what do you think about these mini implants? And he said, I think it's a great service. So oral surgeons are on board. Prosthodontists are on board. It's trending towards becoming mainstream.
We're out of time. Final message. Somebody watching this, they're about to lose their teeth or they're wearing a denture. What do you say? And maybe they're skeptical. What do you say?
Come in, have a consultation. It won't cost you anything. Come in, listen to what we can do. Let us tell you, show you what we can do, and then you make a decision.
All right, great. I want to thank you for. And by the way, we should mention, insurance does not cover the whole procedure, right? Medicare, Medicaid in the U.S. does not cover this procedure. Is that right?
Medicare and Medicaid do not cover the procedure. Some insurances will cover part of it. We have insurance experts at our office come in, and we can talk about that.
You have financing with people with good credit, things like that?
Yeah, we do financing. We want people to have this done so they can improve their quality of life, unleash their potential.
And I guess you say people like coming to your office. You have some fun there.
We do. My wife is a pharmacist at a busy Walmart pharmacy, and she comes in and her hair is sticking out. She's flustered, and she gets frustrated because she says, "You guys have too much fun here." And I said, "I don't know if it's really fun as much as we're excited. We return people to their smile. We not only give them the outer smile, we bring out that inner smile. We unleash their potential. People, a lot of people sit around and when they don't feel good about themselves, they won't go out. We have our beautiful area, hiking, biking, and when you don't feel good, you're not getting out there. So not only can we improve their health, we can get them to go out and improve their life.
Back engaged in life again.
Back engaged.
With a great smile.
Back engaged and enjoying life.
All right, well, thank you for coming on the show. Great stuff, great information. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.